How does the US healthcare system compare to Medicare for all? Have you ever wondered how the United States healthcare system stacks up against the idea of Medicare for all? Let's break it down in a way that makes sense. The current healthcare system in the United States is a mix of private insurance, government programs, and out-of-pocket payments. This setup leads to high costs, unequal access, and varying quality of care. Now, Medicare for all proposes a different approach. It suggests a single-payer system where the government provides universal health insurance coverage to everyone. This means that health care would be seen as a right, not just a privilege for those who can afford it. In the existing system, we see fragmentation. There are many insurers and payers, which creates a lot of administrative complexity. This inefficiency can lead to higher costs. In fact, the United States spends more on healthcare per person than any other country, yet we often have poorer outcomes in terms of access and equity. Millions of people are either uninsured or underinsured, facing financial barriers when they need care. The current system is also driven by market incentives. Providers and insurers often operate with profit in mind, which can limit access to care and drive up costs. On the other hand, Medicare for all aims to provide universal coverage. Everyone would be automatically enrolled, which would eliminate gaps in insurance. The government would primarily cover healthcare costs through taxes, which could reduce or even eliminate premiums, deductibles, and copayments. One of the key benefits of a single-payer model is simplified administration. This would cut down on the bureaucracy involved in billing and payments. Care would be based on need rather than ability to pay, aligning with the belief that healthcare should be a social good. Additionally, the government could negotiate prices and set budgets, potentially lowering overall spending. From a socialism perspective, Medicare for all reflects the welfare state's goal of providing essential services fairly through collective responsibility. This system challenges the profit-driven healthcare market by prioritizing health outcomes over financial gain. It embodies values of solidarity and social justice, asserting that health care is a human right. Practically, Medicare for all could eliminate medical bankruptcy by removing out-of-pocket expenses. It would improve public health by ensuring access to preventive and chronic care for everyone. It could also help reduce disparities in care related to income, race, or employment. While some critics argue that a larger government role in healthcare could stifle innovation, supporters believe it is necessary for fairness and efficiency. In summary, Medicare for all represents a shift from the current fragmented market-based model to a publicly funded, universally accessible system. This aligns with the principles of shared responsibility and equal access to essential services. So, when comparing the two, it's clear that Medicare for all offers a vision of healthcare that prioritizes people over profit.